Today's topic, to think or not to think like a nurse. Why every nurse must possess clinical judgment to be safe in practice. Did you know that half of nurses will make an error in 2/3 of these mistakes are because of incorrect clinical decision making? This is called failure to rescue in the nursing literature, and it's when a nurse fails to respond or recognize a problem and a complication progresses until it's too late and even patient death can occur. Nobody wants to be a villain. We all want to be superheroes and scrubs. In order to do that, clinical judgment is the essence of safe and professional nursing practice. So let's discuss what this looks like and how it's defined so we can better teach it as well as understand clinical judgment. This is an essential equation for practice, and what it really entails is that a nurse must be able to critically think and clinically reason, and clinical judgment is the outcome or the end result. Clinical judgment cannot be taught directly. So then when we look at critical thinking and reasoning, what is it? Let's define our terms. And the essence of critical thinking, though there's many definitions, it's the ability of the nurse to understand and act on what they know about their nursing content. This is why memorizing or parroting out of your drug handbook the mechanism of action is not going to develop the critical thinking required for safe practice. You as the nurse or nursing student must understand your content. That's your goal when you're studying, not just to pass the test. Understand the content to pass the test. Clinical reasoning is what takes place at the bedside. Critical thinking is what takes place in the classroom and in your nursing program. Make it that priority to understand your content, then reason in action with it with the clinical reasoning, which is that ability of the nurse to, in essence, think in action and reason as the situation changes. As you all know, if you've been in the clinical context, patients don't stay the same. They change and can change very quickly. You as the nurse must be able to think on your feet and know what to do to clinically reason when that happens. When you both understand essential content by critical thinking and then reason with that knowledge at the bedside, you will make the outcome of a correct clinical judgment. But if you fail and don't understand your content or unable to reason, you will not make the correct judgment and you'll go off on a bunny trail and you may miss something that could have adverse consequences. And we don't want to do that. In order to really understand the essence of clinical judgment that's required for safe practice, Chris Tanner published her model of clinical judgment back in 2006. And the title of her article was Thinking Like a Nurse, a practice-based model of clinical reasoning. And she identified 4 concise steps that the nurse must be able to do to make correct clinical judgments. And the essence of her model dovetails with nursing process and those 5 steps of ADPI. But if you look at the upper right-hand corner, you've got 4 steps that begin with noticing, then goes to interpreting, goes to responding, and then to reflecting or evaluation. I'm going to briefly explain each of these 4 steps so that you better understand what goes behind the correct clinical judgment. Noticing is much more than the assessment of nursing process, though it's part of it. It's looking at that grasp of the clinical situation, and really the essence of noticing is recognizing relevant clinical data. Do you notice what is relevant or irrelevant that can be left behind? That's not that significant. That's the essence of noticing. Interpreting is step 2, and that's the ability to interpret the meaning of the data. That is why you must, as a student or nurse in practice, understand your path of physiology, because it's those clinical cues or relevant data that usually are based in physiology. Like, why is my creatinine rising and my potassium going up with a patient with heart failure, or their shortness of breath and their ABGs going more acidotic, for example, because their CO2 is climbing. Those are all related to pathophysiology, must be understood. It's also important to recognize that interpreting clinical data is influenced by what's between the ears of the nurse and how they filter that patient's data. So, for example, if you don't have caring, compassion, or assume that you make assumptions about your patient, like they're a drug seeker with that increased abdominal pain post-op and they're really asking for too much medication, they may have perfed their bowel, and that increasing pain is there for a reason. If you make judgments or assumptions, your ability to notice and then interpret is going to be off, and you'll make an incorrect judgment. Third step, responding. You must be able to correctly interpret the data and then act upon it. And really, this is the essence of failure to recognize or failure to rescue. You don't recognize a problem until it's too late. And this is, again, the essence of having the correct nursing priority is, again, part of responding. What is that priority based on what you've noticed, what you've interpreted, and now how you're going to respond? And then finally, reflection is the essence of evaluation. And it's looking at the patient and making that decision in the moment of inaction and looking at what you are interpreting and then going back to then, what do I notice with my evaluation or responding? There's also reflection on action, which is looking at when you make an incorrect judgment. You need to reflect more deeply upon it and recognize, what can I learn from it? We're all going to make mistakes in practice at some point in time. What did you learn and how will you grow and be better? That's the question. So if you haven't already, subscribe to my YouTube channel, Think Like a Nurse, and be first in line to receive fresh content for 2020. And be sure to check out the link on this video to go deeper on this topic. I have a new website just for nurse educators that goes deeper with this teaching, complete with contact hours. And I want to thank you for watching, and use this information to develop clinical judgment, whether you're a student or educator, to better prepare your students for practice and licensure, including the upcoming next generation coming in spring 2023. Thank you so much.